Well, good morning. 7 o'clock on this Martin Luther King Jr. Day. So, a lot of businesses, maybe a lot of schools off today. However, if you do have to get out, you better bundle up. We're talking dangerous cold. In fact, we're going to be happy to see double digits today. I mean, that's where we are right now in the St. Louis area, but really it's that Arctic air all across. I was looking at snow last night on Broadway in Nashville. I was talking to some meteorologists last night saying, "Oh, that's a Broadway I never want to see." But the diehards were still out there. I bet you had girls in their early 20s turning 21 or bachelorette parties where they were in skirts, in heels, and bare legs. Guaranteed, because they're all having fun. And hey, when they imbibe in a little alcohol, they probably feel a little bit warmer. Glad to have you on with us today on this January 5th. About. Beckett Moore joined us last week, and we have had him go viral over the last week, and I'm seeing his numbers go up as well. So we're going to talk with Beckett. You just saw the cultivating a vision. That is something I want to let you know that yes, the ticket prices have gone up. But a lot of you, however, did get a chance to sign up already. I think we have about 20 of you. So you're going to go to my page, TheRealMonicaAdams.com. You're going to click on events, and this is pretty much just taking you through about the event, the tickets, the time, the location. And then when you go to click on the ticket price, there it is, $35 now. And that'll be through this Friday. So I tell you, you have to make sure that you sign up. Otherwise, it will go up again as we lead to the event, which is January 24th. And I mean, we're going to unpack 2023. We're going to leave behind the negativity, but we're going to understand that you've gone through some hard times, the depression, and maybe you struggled. Maybe it was one of the roughest years that you've had. We're going to find a way for you to leave it behind. And then we're going to move on past it. And we're going to carve out 2024 for you. So a lot of things to do today, but I wanted to get that underway. By the way, the Bills and Steelers game was postponed because we're talking about crazy cold weather. They postponed that to today. And they asked a ton of fans to come out for $20 a person to help shovel the snow out of the stands, which is just crazy. One guy went viral, trending right now. He didn't have a shirt on. He was just kind of like a luge straight down in the stands trying to get all that snow out of the way. So kudos to him. The Blues and Flyers tonight. The Blues are hosting them. And by the way, the Blues Hall of Fame, Pavel Demitra, Keith Kachuk, Mike Liut going in. Congratulations to all of them. I know Dimitra's family will be coming in for that. So there's some news you can use and getting that out of the way for you. 7:03. Thanks for tuning in with us. We're talking about the weather. Let's bring our aspiring meteorologist, Beckett Moore, in. Beckett actually is stranded in Chicago, aren't you, my friend?
Yes, all the trains got canceled out of here.
So you have had a whirlwind, though, of a weekend. So Beckett actually went from St. Louis, where he went to Chicago to chase the blizzard, and then it kind of teetered out, and he was like, I'm going to continue to go, and he went in towards Michigan. But let me play something for you in case you missed this last week. This is what happened with Beckett and I. You are doing an incredible job. So going into Sunday night and Monday, do you think it's going to be a bad commute? Do you think there would be a right there tonight? Oh, we just saw that behind you. We both got
We just got
excited.
Thundersnow
I've
here.
actually seen that before in my career, Beckett.
What do you think about that?
I don't know if you heard me, but I was like, oh, we
Never
just saw
seen
that
that
behind you.
before.
And then Beckett just said,
I
I've
don't know
never
if you've
seen
seen
that
the clip,
before.
but Jim Cantori
He's talking about the
before, and
clip
he's
of
going crazy,
Jim
so it's
Cantori,
pretty
where
funny, but
Cantori goes nuts.
he's probably going crazy
Look that up.
right
It's
now.
hilarious.
For me on camera.
And then I asked Beckett, there it is. That was my favorite. I asked Beckett to do his own version of going nuts. So tell me a little bit more about the fact that you took that clip, he put it on X, and the last I saw, I think it was closing in like on 200,000 views. Isn't that right?
Yes.
Yeah, you went viral, my friend.
I know, it's crazy.
So, I mean, when you got done with that report with us, did you kind of unpack that and say that was like one of the coolest things? Because not a lot of people get to experience that.
Yeah, absolutely, because it's just really rare to see thunder, see lightning in snow. And I'm pretty sure Jim Cantori actually had the same strike that we had, and he had another funny clip.
I did. I saw that. Well, we're going to go through what you have had a chance to experience this past weekend from Chicago, the lake wind effects as you go into Michigan. And we're going to do all that. But first, let's talk about what St. Louis is expecting here, because as I mentioned in the beginning, Beckett, we're going to be excited to even see double digits today.
Yeah, so today the high is 10 degrees, so we're not even going to get above 10. -2 is our low, so this is going to be the coldest day of the week. And then tomorrow, 17 is our high, so warming up a little bit. 12 will be our low. We warm up to Wednesday to a balmy 37 degrees. Thursday, 34. No precipitation expected, maybe some light snow Thursday. And then on Friday, we go back down to 17, 16 on Saturday.
You know, over the weekend, I celebrated my final Christmas with some friends back at. They came over, and I couldn't believe it happened again. 2 weekends in a row. I told you just a light dusting makes us not be able to get out of our driveway. So they had to walk up our long driveway on the side because their car would have slid down. So things like that can happen. I mean, even a little bit of dusting, and some of the stuff that I'm seeing for later in the week, I think I was seeing like a 40% chance of snow maybe in the afternoon, evening on Thursday. But are you expecting much accumulation with that?
It's not looking very big right now. I think we still need to dive into the details a little bit, fine tune it, but I don't think it's looking like a big snow system at all.
Well, that's good to hear. Again, if you're just tuning in, you can see it's Beckett Moore, aspiring meteorologist. As I mentioned, what he had a chance to do over the weekend. Let's just kind of recap this. First of all, this is super exciting. Look what happens here.
I want to bring in right now special guest. He's been out on the streets of Chicago, meteorologist Beckett Moore. I should say aspiring, but I feel like you're already in.
Absolutely. That's the thing that I've been saying, Beckett, is I know we have to say aspiring because you haven't gone through all the schooling yet to become an actual meteorologist, but we all feel like that. Tell me what it felt like to be interviewed live in person on Fox Weather.
It was an incredible experience. I'm so thankful that they invited me on, and it was just so fun talking to Amy and going over the forecast and being able to talk about that on national television.
Now, I know a lot of people were saying online on social media they were hoping that you and Cantori were going to be able to meet because he was in Chicago as well.
Yeah, we weren't able to.
That would have been a dream, but
Yeah,
that's
it
not
would
the
have.
first time you've been on Fox. You were on Fox about a week and a half or so ago, weren't you? I know it wasn't in person, but you were on virtual with them.
Yes, I was.
How many times have you been on national?
Um, 3 times, I think.
3 times over the
Yeah,
last couple of years?
I think so. Yeah.
So Beckett is definitely gaining momentum, and I love the fact I've been watching your ex, you have definitely gone up in following, but it's the amount and the authenticity that Beckett brings and the accuracy that Beckett brings to get the following and get the amount of views he has. You have accolades coming from all over, from people that are younger like you that are aspiring, and then from actual meteorologists that are following you as well. Cantori actually verified the Thundersnow and then retweeted you.
Yes, he did, and I'm very thankful for everyone that supports me and like Cantori for retweeting me too.
What did that mean to you when you saw that? Did you get all super excited?
Yes.
How can you not? That's definitely one of his role models. Again, Beckett and I are recapping. Now, this was crazy. I was just talking about the guy, Beckett, that had no shirt on, that was kind of like doing a luge because they had to postpone the Bills game and they're trying to get all that snow out of the stands to be able to have the game today. But this is what Beckett saw. Where are you here, my friend?
Is this the clip on the beach where
Yeah.
it's like really windy?
Yeah.
That's in Holland, Michigan on Ottawa Beach.
No!
So you see a surfer and then he just jumped in.
No way!
Yeah, he jumped into like the little channel in between the lake that goes to Holland, Michigan, Lake Michigan, and he jumped in and rode across it to the other side. It's crazy.
What? Okay, there's some crazy, crazy people out here. This is one of my favorites, so watch this, folks.
No!
At Ottawa Beach, and significant winds are blowing in right now with blowing snow.
Look at, he's
lake
about ready
effect
to fall over.
snow showers. This is very intense conditions here at Holland, and there's even some surfers out there, believe it or not. I thought I was
Okay, so how bad were the winds there, Beckett?
They were gusting up to 40, 45 mile an hour, I think, at times, and they were the worst Saturday morning, yesterday morning, or not yesterday, the day before yesterday, but they were the worst Saturday morning. And you literally could just go like this and they would push you back.
That is nuts. I mean, again, get used to this because what Beckett is wanting to go into, he'll be out in conditions like this, but he thrives on it. And then tell us where you are here. You're on a mound of snow.
Yeah, so that was one of those big mounds of snow they made from just plowing snow from this last system, the lake effect snow, and the system before that about a week ago. So all of that put together, they plowed it into that huge pile. And one thing Michigan does know how to do is plow snow because there are so many plows out there. And somehow they kept some of the roads clear, even though it was snowing like crazy.
Okay, but then one of the things that we always talk about, Beckett, obviously, right, is to tell everybody to be safe. This morning in our particular area, we're saying if you have to go out to bundle up, watch the exposed skin. We're not talking about actual road issues. There is some. I was turning on Channel 4 this morning. They were talking about some pipes that were bursting. That's the thing that we have to be worried about. And then flooding conditions maybe at businesses. But if you don't have to have your employees come in today, give them day off for Martin Luther King Jr. Day and keep them safe. That's why we're doing the show virtual today. I didn't want to put any of my guests in danger, but it was the driving conditions and the whiteout, folks. Look at this. Where is this? Where were you driving here? Your dad obviously driving.
We were in between Holland and South Haven, Michigan, and this was where it wasn't even snowing that heavily. It was just the blowing snow from the fields on either side of us that just came in to the highway with that light snow combined, creating, almost zero visibility.
Yeah, nuts. And then you end up getting back to Chicago, expecting to come home. I saw a fun social media post from your mom, Jill. And do you have two dogs, Beckett?
Yes.
Yeah, and she posted a social media post, and it said that the dogs were waiting for their favorite weatherman to return, and then all of a sudden they can't return. So, how are you getting back to St. Louis?
We rented a car, so we're gonna drive that car back to St. Louis today.
Oh, goodness gracious. Well, it's been a whirlwind for you. Is this in your 2 years of forecasting weather as an aspiring meteorologist? Was this the most exciting for you?
Definitely.
So, what's on tap for you next?
We're gonna go home and then Storm Chaser Summit is actually early February. That's where all the Storm Chasers converge in Dallas. So that'll be in Dallas and I'll be there.
I love this. He just continue to go and go and go. Where are you going to high school?
DeSmet Jesuit.
So you start there later this fall, right?
Yes.
And then where do you want to go to college?
I've looked at OU and I really like it.
Fantastic. Well, we are going to have Beckett on as often as he wants to, and we're going to continue to follow his career. I'm excited because I think that he's getting more and more and more followers. So I want to remind you on X, you can follow him at More Weather Official. That's WX as weather, More Weather Official. And then he's also on YouTube at More Weather. Are you on any other social channels? Because I want to make sure we give all of them to him.
I'm on Facebook, but I don't post over there.
Okay. So mainly you would want people to follow on YouTube. That's where you really go in depth.
Yes.
All right, so let's get you to subscribe and follow to him here. One more time, Beckett, what's on tap for us weather-wise?
So today, high of 10, 17 tomorrow, warm up to mid-30s Wednesday, Thursday, back down to the teens Thursday, Saturday, or Friday.
Well, I greatly appreciate you taking some time for us because I know you're trying to get back to St. Louis. Please be safe. Tell your dad and your mother thank you so much, one, for raising an incredible human being, and then two, for all of their support because that means the world.
I will.
All right, Beckett, we'll talk to you soon.
See ya, bye.
Stay with us, everybody. We have more to come here on The Real Monica Adams Show. Invita Health and Wellness, where you can feel your best both inside and out. Invita isn't your typical med spa. They're a multi-specialty medical spa and wellness center serving St. Louis and its surrounding areas. They have ketamine for mental health and pain, IV therapy, medical weight loss, and aesthetics treatments. As board-certified anesthesia providers, Invita can ensure that their advanced treatments are provided safely with minimal to no pain. So let Invita take care of you. Call 314-394-0950 to book an appointment or online invitahealthandwellness.com. Think about this. When's the last time you called your doctor at 2 o'clock in the morning and he actually answered? Well, at Innovare Health Advocates, their patients are special. Their doctors, nurse practitioners, their care team care deeply about your health, your family, your work, and even your pet. Their clinicians are accessible and they lead your care in and out of the hospital. In fact, Dr. Charles Willey offers his cell phone number to his patients to ensure they can intervene early in your illness. They can provide care above and beyond, offering lab, x-ray, echocardiogram, and other treatments in their office. Innovare Health Advocates with 5 locations on both sides of the river. Check them out, innovarehealth.com. Welcome back. It is Monday, January 15th. It is Martin Luther King Jr. Day, and there are some events, by the way, that are going on outside and inside. Later this morning, they're going to have a motorcade, so bundle up if you're going to go to that. They will, of course, have some, the mayor will be speaking. They are also inside events. I think the symphony's actually even doing a free event dedicated to the late, great Martin Luther King Jr. Let me look at some comments. We are going to talk about medicine and Ask the Doctor, Medical Monday. Julie says, I'm off, and good morning. Good morning to you, Julie. David Coaster, good morning to everyone. I think you are a new viewer. Let us know where you're watching from. Marilyn, good morning. Already signed up? Yes, we're talking about the Cultivating a Vision. If you haven't signed up yet, you do have the next couple of weeks. The price has gone up, but you do not want to miss this. It's $35 now for you to attend the event with myself and Kasia Satars on January 24th. It's going to be a phenomenal event to change your life and carve out the life that you were meant to live. So, Marilyn, I'm glad you signed up for that. Good morning, Michelle, Kathleen, Leona. A great football weekend. All my favorite teams won. Well, congratulations to them. Did you watch that Chiefs game? I cannot even imagine. Miami fans, how it was a wake-up call for them to go, what? I did not sign up for this. I was expecting the stadium to not be overly packed because of it, but nice to see the fans come out. Rose, good morning. David, let's see. Pamela, good morning to you. Sean, is his dad his cameraman? Yes. And I got to say, by the way, Beckett's father did an incredible job. So I was thinking that he has a future in being a photographer or videographer. Beckett, our local weatherman following you, I believe they do. I know that they've reposted him. Have you toured the meteorologist site in Weldon Springs? You'll have to ask him that next time he is on. That'd be interesting. Yes, he's going to DeSmet. That's what he wants to do. Safe travels to him, and good morning to Kathy as well. So as you're tuning in, if you are brand new to the show, know that I shout out to you. I try to get all of your comments and questions in, whatever we can do to make sure that you feel that this show is for you. And we said down below, you can see special thanks to our growing list of sponsors. Of course, our title sponsor, Invita Health and Wellness, Innovare Health Advocates, and Kathy Kilo Peterson. Now, we normally start our show on Mondays with Dr. Sarah Franco. Dr. Sarah Franco had to take the week off. We're going to be back with her next week, and she's going to talk about all these crazy trends that you see out there that people are doing and everything that you believe online that maybe you shouldn't be believing. So she's going to break some of that down. And if you have any trends you're seeing that you want to ask her about, you can drop some comments to me right now, and I'll be sure to pass those along. But she's gathering some already. And then Dr. Charles Willey usually comes on with us at 7:30. We were going to kick things off with him early. I don't know whether he's in an emergency or if he has slept in, but I did just send him a text and say, we're on and your patients are on. Let me bring them on with us. Here's John Donovan and Louise Donovan. First of all, good morning and welcome to the show.
Thank you. Good morning, Monica.
Good morning. And Louise is your mother, right?
That's correct. Yes.
Okay. I think she's frozen here for a second. So I'm going to talk. John, you have been a patient of Dr. Willey's for how long?
Pretty much, let's see, a little about the last year.
And why are you continuing to sing his praises? Because one of the things that we have said about Innovare Health Advocates is that he's very, very different in the way he focuses, the patients he has, and we're going to say in a second how he diagnosed you. So what is it that you want to tell people that really stands out about Innovare?
Sure. Thank you very much. Well, I'd say the number one thing about Dr. Willey and Innovare is that there are really true and passionate advocates for your whole health. And that's come into light as to what that really means for me here over the course of the last several months. Dr. Willey was instrumental in helping me get the appropriate care and treatment for a brain tumor that I discovered I had. And throughout the course of that discovery process, really what we were facing, or what and my wife and family were facing, were a bunch of um, diagnoses, or a bunch of symptoms that really didn't make sense. I was having severe problems with balance and walking and memory, strength, leg strength, especially too. And you put all of those together, for me, I just didn't know what was happening here. And of course,
Absolutely.
yeah, and you go out on the internet, you look up a bunch of crazy symptoms, and you get a bunch of crazy diagnoses. So don't do that, by the way.
Exactly, John. We've said that so often. Stop WebMDing.
Yeah.
Stop trying to figure out. Turn it over to a good physician. Louise is your mother. Louise, what? I mean, for a parent to find out, I don't care what age your child is, that your child has a brain tumor. What did that mean to you? Kind of walk through that. I know that's scary.
Well, it still brings tears to my eyes. It was a shock, and it's a hard sentence to get out of your mouth to say, my son has a brain tumor. And it was awful and a lot of worry. But the most frustrating thing was that everything was taking too long. And there was no, to wait 4.5 weeks for an appointment with a neurosurgeon when a patient has a brain tumor and those symptoms is frightening. And I knew it was wrong.
Absolutely. So once again, if you're just tuning in, it is Medical Monday, the Ask the Doctor segment, and we're talking with, you just saw Louise Donovan. We also have John Donovan, and we're talking about his actual diagnosis. And then here he is, the man himself, Dr. Charles Willey. I just told everybody, I'm like, I don't know if he's got an emergency or if he overslept. He sent me an email that I just happened to see like seconds before I went on the air at 2:30 in the morning. Why were you up at 2:30 in the morning, Dr. Willey?
Just getting the job done, Monica.
And that's it. That's literally what we're talking about. So he is the brain behind Innovare Health Advocates. And we're visiting with John and Louise, just two of the many patients that Dr. Willey has. And we're talking about how your early intervention may have saved this gentleman's life. So you want to talk about what happened back in November, Dr. Willey?
Well, it's, I have a quip that if I ask people if they have a doctor in the family, and if they don't, look them in the eye, shake their hand, and say, now you do. Because that's really how I treat folks. And that's the way it ought to be. Because many times it's really critical to make an early diagnosis and then to get the treatment to happen. And that's a big part of the challenge these days, because healthcare has become so bureaucratized. There's protocols and rules, and what you need is a little human interaction. Okay, what needs to be done, and let's get it done. So that's the difference. So, Louise is actually an old neighbor. I think John was out and about by the time we met him. But anyway, my wife Ann still has breakfast with Louise, and they're having breakfast. And I'm getting texts from breakfast. Hey, John's got a brain tumor, and he's got an appointment in 4 or 5 weeks. I said, what? That's nuts. So I got his permission to look up his CAT scan, and had a look at it, and then got his text and saw him the next day.
Hey, yeah, I mean, that's the thing. A lot of people, the problem that they have is how it's going through all the red tape, trying to get in. And that is not the case with Dr. Willey. That's one of the things that when we're talking about, when you have a physician, is your physician fighting for you? Is your physician getting you in a timely manner? Dr. Willey, you were just mentioning about the brain tumor. So we actually have a couple of MRI slides. We're going to pull up first. This is the normal brain, right? Let's look at this one first.
Yeah. So, with a grain of salt, this is my wife's brain.
Okay. She seems like she's very intelligent.
Well, I don't know. She married me, so there may be a kink in that
there you go.
Flaw in that. That's right. But the thing to focus on is this darker space here. These two, those are called the fourth ventricle. There's a circulation system in the brain, and there's 4 sets of ventricles. The others are further posterior and inferior. But these are pretty normal, right? They're symmetric, and that's the way it's supposed to be. The rest of the brain tissue on this film is pretty even. These little dark lines are normal. A little space between the brain and the skull is normal. So,
okay.
Yeah. So just focus on that symmetry. Oh, an echo.
Yep. Well, let's go back to it. But let's go
Let's go
to the
to
one.
the one.
Hang on, let me
Hang on,
get.
let me get.
I need to
I need to
remove
remove
Louise. I think we're
Louise. I
going to
think we're
do that
going to do
first.
that first.
So
So
this is
this
the
is,
normal one, but let's look
but
at.
let's look at.
You also
You
sent
also
me
sent me
a
a
picture of
picture of
John's
John.
MRI.
Wow.
Can we go through that, Dr. Wu?
Yes. Do you have an echo?
Can you go ahead and just break that down for me?
Yeah. So even the person on the street can see this tumor. That's not supposed to be there, right? Remember the symmetry of the other, and look at the misshapenness of the ventricles themselves. So it's what it's doing is clogging up the flow of that fluid in the ventricle, causing this one to inflate. This is his right side, causing it to inflate, and it's pushing the whole brain over to the left side. Notice the line in the middle, instead of going straight down, now goes over this way. So the tumor itself wasn't causing him any trouble, but the clogging of the fluid and it's, technically he's on his way to hydrocephalus. Hydrocephalus is when that system gets clogged and it inflates and then crushes the rest of the brain. So he was what we call ataxic. He's walking around like a drunk, even though he's not drunk. Trying to go up and down steps without falling and breaking his neck or getting a brain bleed. So it's a serious issue right away. Not the least of which uh, is they told him he has a brain tumor.
Yep.
Right, and call central scheduling. They said. And 4 weeks later, he would have had an appointment. But that's just not good enough for anybody. So if you're my patient, we're going to get it done.
Right. And I asked John to send me a picture. If you're just tuning in, Dr. Charles Willey with Innovare Health Advocates, John Donovan, who was, again, diagnosed with a brain tumor and got in, this was back in the late end of November, and was in the hospital for 3 days. And I asked him last night if he could take a picture. So that's a picture of the scar from his surgery. John, I mean, walking through all this, what did you start noticing? What was starting to happen for you to be concerned, and that it turned into hey, you've got a brain tumor? I mean, just walk us through that.
Sure, you bet. Well, really, I started noticing these symptoms. Like I said, they didn't seem to plug in together or make any sense to me. And I'm a reasonably healthy person, but I started noticing real difficulties walking. One of the first things. It looked like my wife liked to call me Igor because I was kind of slumping and dragging my right foot. Uh, yeah, and now that I have the scar there, I really do look like Igor. Let me just clarify that. Right away after surgery, I can tell you within a couple of days, the walking came right back to me. But in addition to the walking, balance was a severe problem of mine. I felt like I didn't know my place in space, if that makes any sense to
Sure.
you. And, um, my memory was really starting to have severe problems, especially on the short term memory. You could ask me something, I'd give you an answer, and then if you ask me the same 2 minutes later or 5 minutes later, I might give you an entirely different answer to that. So really, it was all of these different symptoms, and there were many others as well too. Strength, like I said as well earlier, was a real problem for me, and it just didn't make any sense to me. And so that's when I went and I had an MRI of the brain. The brain showed a tumor, and then Dr. Willey got into action right away. As he mentioned a minute ago, this was actually on Halloween on that I got the MRI done, and they were going to get me into a neurologist in November. Uh, Dr. Willey met with me the next day, actually, and then I had my surgery on November 29th, which was even before they were going to get me in to see the neurologist for. So, and part of it too is Dr. Willey, in addition to getting me into a neurologist right away, got the best neurologist. And those were the folks down at Barnes. Dr. Demetrio was my surgeon, amazing job. And now I'm recovering very, very quickly. Everything that Dr. Willey and Dr. Mathios said about my recovery, I'm tracking exactly to what the plan was.
That's incredible. Again, this is what we love about Dr. Willey. This is what he will do for you. And if you do not have a physician that will get you in the time frame that you need to, I mean, literally, Dr. Willey saved his life. That's what I believe. I mean, and I think that's probably what John believes as well. I brought up some slides, Dr. Willey and I were talking last night. So we're talking about a brain tumor that he was diagnosed with. Can you break this slide down for us?
Well, we saw the MRI. This is an external look of the whole brain, um, and this imagines a tumor in the brain substance itself. But John was lucky; it was in the circulating system and grew there, where there was space not to destroy brain tissue. And as I mentioned before, it clogged up the ventricle, so it inflated the ventricle and crushed his brain. So that was very fortunate. Left alone, it would have caused more and more damage. It would have killed him in time. So this is the brainstem. That's the balance part, the cerebellum, and that's the thinking part. And yep. So one of the tactics I had, I even have trouble getting people into barns at times. I don't need barns very often, but if I do, it's usually urgent. And I know if they're listening, their movement disorders clinic, the appointments are 18 months out. So,
Wow.
But my tactic there was that, I saw John the day after I heard about this, and then I referred him to Dr. Polinsky, one of the best neurosurgeons that's not at Barnes. Okay. Because I knew that Dr. Polinsky he could handle that surgery himself, but if he thought that Barnes had a better method, and actually they have a new gadget that could help him get that thing out of John's brain without causing much trouble at all to the rest of the brain. In surgery, the big breakthrough of the modern era is they don't wreck much on the way to the problem. Used to be they had to wreck a bunch of stuff on the way to the problem, especially in the brain. But so I knew that Dr. Polinsky would not keep the case. This is really important because many surgeons wouldn't do this. He wouldn't keep the case so he could do it, even though he didn't have the best solution for John. I knew he would send him to Barnes if he thought that was the case. And indeed he did. Dr. Polinsky could have done that case. He's done them before, but would have to give John a bigger scar and maybe a little more duress on the rest of his brain. So he helped me get him into the surgeon at Barnes.
Well, and thankfully so. And that's why John is sitting here in front of us today and able to get back. John and I were talking last night for a couple of hours, and then he sent me these wonderful pictures. The entire family is involved in martial arts, and he wants to get back into that, don't you, John?
I do. Although I'm
Say that again?
I said I'm going to watch my head. I don't want to get hit in the head.
No, we don't want you to. So all of your kids are involved. And did you say you're all black belts?
All of us except for my youngest. So correct.
Gosh. Don't mess with John Donovan.
Up here, so I'm a little slow these days.
John Donovan and Louise, his mother, she's having some problems with her computer. Oh, hang on. She's the one that I'm getting some feedback from. Let me turn this down. I'm going to take a quick break. We're talking with, again, Dr. Charles Willey from Innovare Health Advocates and John Donovan, one of his patients that he was able to intervene early and get his care underway so that he could truly save his life. If you have any comments or questions for Dr. Willey or for John, and hopefully maybe if we can get Louise back on, please just put them into the comment section and we'll get to those. We're going to take a quick break. We'll be back right after this. Think about this. When's the last time you called your doctor at 2 o'clock in the morning and he actually answered? Well, at Innovare Health Advocates, their patients are special. Their doctors, nurse practitioners, their care team care deeply about your health, your family, your work, and even your pet. Their clinicians are accessible and they lead your care in and out of the hospital. In fact, Dr. Charles Willey offers his cell phone number to his patients to ensure they can intervene early in your illness. They can provide provide care above and beyond, offering lab, x-ray, echocardiogram, and other treatments in their office. Innovare Health Advocates with 5 locations on both sides of the river. Check them out, innovarehealth.com.
You are truly an incredible human being, and just what you're doing is so inspiring. This was really a cathartic experience for me. So I appreciate you, love you.
It's been an honor to not only just be here on set with you, but just to sit in your presence. You inspire everyone around you, from your motivational speaking to your podcast here, to just being the human that you are.
It's just such a joy to be able to see you at this point in your career. Really following your passion, fulfilling your dreams, and encouraging other people to do the same.
I feel that I've been missing out. I believe God places people like you in people's lives for a reason. You have definitely been a God wing for me.
Well, thank you to each and every one of you and for the kind things that you say. We've got so many testimonials, I'm told, by our team about what this show has meant to them. We are talking about your health today, Medical Monday, and Ask the Doctor that we do. We wanted to keep our guest safe today because, as I do the forecast for you again, we're talking about -1 downtown, but it's -5 out in St. Charles County in O'Fallon, -7 in Herman. Everybody below 0 for the most part, and we're going to be lucky to try to get up to double digits to maybe 10 or 12 degrees. Can you believe that? That's it. That's all we're talking about today. And it's going to stay in that cold temperature range until Wednesday and Thursday. May see some snow Wednesday afternoon into the evening. Not sure about accumulation. We'll see as we get closer to that. And then again, these temperatures, dangerous conditions we're talking about. If you absolutely positively have to go out, please bundle up, exposed skin. It's the wind chills. Again, the 20 and 25, -20 and 25 wind chills. That's what it feels like on bare skin. So please be careful this morning. 7:37, if you're just tuning in, we're talking about a brain tumor that this gentleman up top right was diagnosed with, John Donovan, and then his doctor, Dr. Charles Willey from Innovare Health Advocates. John, you were just mentioning to me, I was talking about the snow on Broadway in Nashville, which I love Nashville, but I would not want to be there right now. But your daughter was there?
Yeah, she goes to school there. She's actually finishing up her senior year in nursing. And she drove back yesterday to get ahead of the storm, and it came in a little bit early. And she said it was just absolute pandemonium as she got in late in the afternoon yesterday. So everything you said earlier was spot on.
Yeah, I mean, I'm telling you, if you look on social media, the pictures on Broadway are just crazy. I was like, okay, I do not like Broadway looking like that. I like to go there when it's warm. Okay, so we're talking about John and Louise. Louise is having a couple of issues, unfortunately, with her computer. But let's talk about this, Dr. Willey. Besides, on the exact same day, oh, it looks like Louise might be back. I want to bring her back, even if it's momentarily. Louise, hello. You're having some little issues there this morning. Uh-oh, she is again. Oh, let's hang on. Let's remove her from the scene. Well, let's do this. Not only the diagnosis, Dr. Willey, but on the exact same day, John's telling me that John, it's one thing to stay together as a family, but this was a little crazy. So on the exact same day, Dr. Willey, what was Louise going through?
Well, she was vomiting and losing weight. And if Louise lost any more weight, she'd blow away in a windstorm because she's already a beanpole. She's skinny. So she had an obstruction in her biliary system, and frightfully at Louise. Now Louise has achieved middle age, right? I think might have said on the program that middle age starts at 75, old age at 95. So Louise is middle age, and at middle age, if you have that symptom, and you don't have a gallbladder, the chances are frightening for cancer of the bile system, maybe the pancreas, the liver, or the bile duct itself. So she had an obstruction in her bile ducts, and
And
needed
Louise, what were you feeling? Because she's on right now with us.
Nausea and pain, right upper quadrant pain, and nothing. Just the food. Nothing felt like it. I couldn't tolerate it. I just couldn't tolerate it.
Okay,
And
continue. Can you hear us? I think she's having some connection issues. So Dr. Willey, so there's things that people would dismiss there, right? Okay, well, I'm not hungry. I'm losing a little bit of weight, and sometimes they dismiss those things, which could be very dangerous.
Yep, especially if appetite's a simple. Oops,
Go ahead.
Louise, you back?
No, go ahead, Dr. Willey.
Yeah, appetite's common thing. It comes and goes. Unfortunately for me and others, it's too much appetite. But it's if there's an illness and there's loss of appetite, that's a clue that something serious could be going on. And so for Louise, it was persistent nausea, vomiting, weight loss. And so she got the test done that said that there's trouble in her right upper quadrant in that bile system. Blood test was elevated. That's a clue about it. And so when I heard about that, she had the procedure scheduled, but it wasn't soon enough. I mean, Louise is losing weight. She's already too skinny. So I thought, well, okay, I know the guy. I know a guy who'll do that usually pretty quick. And he said, listen, I can do that today if you admit her. If you schedule an outpatient, and it's one of my favorite hospitals, but it was going to take too long. So I admitted her, and then we got it done the next day. So we went around, we bent the rules to get this done quick so she could stop having nausea and vomiting and start eating again.
So if she hadn't gotten in, if you were not that advocate that we always talk about let's say both of them, Dr. Willey, if John hadn't gotten in as quickly as you were able to get them in and Louise hadn't gotten in, I mean, we're talking about detrimental conditions for them.
Yeah. So it's what else could happen in that context. And as I think I mentioned in John's case, does he fall down the stairs and injure himself in a greater way? I mean, be careful on your steps. And if you don't have two banisters, install two banisters and hold on, especially as life goes on. I can't tell you how many, permanent injuries, brain bleeds, broken spines, even death from falling downstairs. So that's the case in John. But at Louise, again, she's already too thin. She's not eating and drinking. She's vomiting. And so that can beget electrolyte trouble, low magnesium, low potassium, low high sodium, and all of which can, change heartache. Things can happen if we don't correct these items quickly.
Mm-hmm. Again, if you have questions, which it looks like some people are saying different things. Let's see here. Dr. Willey, I've been noticing that quite a few people I know are getting tumors on the brain, the pituitary, the optic nerve, et cetera, other brain issues. Two good friends of mine had exact same thing. What do you think are some correlations that contribute to any brain issues? Any thoughts on that?
I don't have on my short list, my small brain, that there's anything environmental or any even increase in brain tumors, except perhaps folks are living long. Oops, that's the wrong way. I'm tightening my tie on the video. It's but people are living long now. John's a young man. He's just a kid. He's only in his early 50s. But many of them we're seeing in older folks who listen. When I was 6 years old in 1960, the average age of death for a man was 60 and a woman 65. It's now almost 80 and 85. So folks are living long and having an opportunity to get more troubles. And it's hard to be careful making a conclusion about a small study of two of your friends. Yeah.
So you don't see any correlations, any issues that you have seen in your practice, or anything that we're eating, anything in the environment, et cetera?
No. I really don't have anything on my list. I don't counsel people about their lifestyle to prevent brain tumors.
Okay.
Now we do that for, heart disease, et cetera, but but not brain tumors.
It is interesting that she says that. I do have a couple of friends that I know, but it really is just, it's kind of like anything in life. We even talk about that with regards to advertising. You don't hear anything until you actually need that, right? We're paying attention to our friends, but maybe it's
Yeah.
been out there. People just haven't been talking about it. I have a friend that went through it as well, and still struggles. Do you have any lasting effects right now, John? Because I'm thinking of the things that my friend is still going through years later.
Yeah, I would say the direct answer to no, but I'm about 5, 6 weeks removed from surgery. The way that Dr. Willey and Dr. explained it to me was that the physical issues that I was having, like walking, and those would improve the most quickly,
Mhm.
and I have. I mean, I was up and walking within a few days of surgery, and walking without any of the problems that I previously made. And
That's incredible.
the cognitive and the mental issues um, would take a little bit longer, but I can tell you already my memory has gotten a lot better. It's not exactly where I want it to be yet, but it is getting there. So no, I would say the direct answer is I feel right now too. I feel very light, is the way I like to describe it. My brain is kind of at peace now, where before it was kind of battling itself. So I would say the direct answer to your question is no.
So, John, looking back, you're talking about this battle that was going on. I mean, now that you know you have a brain tumor, if you look back, how far back can you reach to think, wow, this might have been the first time that this was all creating some problems and I hadn't gotten in to tell my doctor yet?
Yeah, that was. We were in the process. We've moved a couple of times. Well, we spent about 50 years out in Seattle for my job. And when you asked how long have I been with Doctor, kind of shortly after I moved back to St. Louis, which is my hometown. But I would say, Monica, my wife and I have had that discussion, and we can pinpoint some times going back, a few years, several years. I would say probably it's probably been going on for upwards of 5 years that we've started to notice, some oddities, I guess you would say.
And this is the thing, John, and anyone that's listening right now or watches this later, we all too often dismiss things. And I don't know why. This is why I love Dr. Willey and have for 20 years. He literally would want to tell you, don't dismiss it. Don't think, oh, I'm going to bother the doctor. I'm going to bother the staff. He regularly tells you every Monday that it's that line of questioning. It's the comments. It's the time spent. Don't you think that's what's different, John? I'm sure if you've gone to doctors before Dr. Willey in the past, it's the, oh, doc, hang on. I want to ask something. And they're in and out so quick. And that is not who Dr. Willey is at all.
No, I totally and completely agree with that. And the word advocate is absolutely a great word to describe Dr. Willey. Yeah, it's really, I throw the word around holistic, but it's more than, it's connecting pieces of a puzzle that may not, you as a patient may say, that does, those things don't connect. But when you put it in the hands of somebody like Dr. Willey, who, has that kind of holistic knowledge and is interested in your entire health, he can say, let's check this out. Let's check that out. And it absolutely has been a life changer for me. So no question about it.
Dr. Will, you want to kind of elaborate on that? Kind of walk us through when John or Louise, or where's Louise again? Trying to come on. Hold on. There we go. When they come into your office, it's the time spent and it's your line of questioning. You want to go through that a little bit more?
Yes. So let's see. Wise. Well, go back to poignant things in when you're young and in medical school and learning stuff. And holy cow! So a wise fellow said, an internist, by the way, that 90% of diagnoses are made in the history that's talking to you, and you can add about 2.5% with the physical exam and another 2 to 5% with testing, and so the interview, the physical exam. By the way, the physical exam starts in the parking lot. Watching the patient walk in is really critical. So it takes time to understand what the symptoms mean. Now, in John's case, he's having trouble walking, thinking it might have been a little direct, but often people, well, he did use the term, my brain is battling. If he came to me and he said, my brain is fighting itself,
Yeah.
that's a that would be a first-time symptom. His symptoms were beyond that. He was ataxic. Um, but we'd really question it. Okay, what do you mean by that? And then a detailed neurologic exam to see which part of his brain isn't working, because the brain's a computer. Its nerves are wires, and if the wiring to a part isn't working just right, that represents that wire goes back up to a specific part of the brain. So you make a lot of inference about what's the trouble even before the scan, right? So it's really critical. Some people get annoyed that I ask too many questions, and I have to slow them down. They really don't have a grip on what this means to you. So I spend the time to define it.
I would never get tired of a doctor asking me, because at that point, you know that every question from this one to the next one to the next one is breaking down diagnosing. And then if they need you to send you on to a specialist, or they need you to get into the hospital right away. And the great thing about a gentleman like Dr. Willey, 40 years in the industry, is that he is so connected that he can get you in right away, instead of, as you're trying to do, trying to make all these phone calls. I mean, that's a scary thing for an entire family when someone's got a brain tumor and you're trying to get in, right, John?
No question. Yes.
It's like, get me in already, get me better, get me well.
So, Monica, can take the time, because I'm configured to be able to use my experience, my education and experience. So I have a team. Now I got 2 young docs and 4 former intensive care unit nurse practitioners, and so we can mobilize when and where we're needed, and bring our our best efforts to that issue. So I'm flexible. I've got flexibility. I rove the offices. They if there's a tough case, if I need to, some people will be frustrated that they'll be late. Well, that's because I'll be late, because I might be, delving into something more serious. Sometimes we'll ask people to reschedule because we've got a more urgent case coming.
Sure.
You suffer that in the emergency room. The sickest people get the first attention, but so we do that as little as possible. But we're flexible to set up to deal with illness. Brain tumors don't make it. They don't schedule an appointment. They just happen. If it's weekend, it's Christmas, it's 2 a.m. or 2 p.m. People get sick when they get sick, and they need help then, not a month from now.
Absolutely. And especially when you're talking about something to the level of what John went through. I mean, you hear those 2 words, brain tumor, and immediately it is, help me, right? Get me in. Let's get this, because he wants to get on the way and get back to his family, get back to his martial arts. Once again, if you have not tuned in, this is what we're talking about. Ask the Doctor, brought to you by Innovare Health Advocates. I want you to go to that website, innovarehealth.com. And we've mentioned on the show before, Dr. Willey is in multiple locations on both sides of the river, so Missouri and Illinois, and can become your doctor. The great thing that Dr. Willey's been talking about is Essence Healthcare allows you to change your doctor at any point throughout the year. And Essence itself, remarkable. Dr. Charles Willey, absolutely remarkable. If you don't have this kind of care that John and Louise have talked about, I want you to think about the change. Christian just said, Dr. Willey, we need more of you. Oh, don't go away. We need more Dr. Willies. Yes, we would love it if you could duplicate yourself. But since he can't, he has the people that he teaches the tutelage underneath him. So it's not just you, right, John? Have you had the opportunity to work with others in his office?
Absolutely. A couple of his offices here in the St. Louis area, and his description of them is spot on. I mean, everybody I felt was on board with exactly the mindset that Dr. Willey has just discussed. And I just felt like I was in great hands every step of the way. And I can't thank him and his staff enough.
And that's the thing that Dr. Willey's mentioned in the past, is that he wants to make sure that everyone working underneath him has the same protocols, that has the same connections. Obviously, everybody brings something different to the table, but in the event he ever retires, which he says he's not, his wife may say something different in the next 5 to 10 years, but if he were to, that he would know that those continuing after you would continue to do your care, right, Dr. Willey?
Yeah, that's right. And that's part of, I could probably handle the whole program, myself and the 4 nurse practitioners, and I'd be working a whole lot more and not be as available, going too fast. But I've got one doc to help, and the second doc mainly for the future. I need my practice to go on without me someday, right? Um, and got to be ready because, you know, something may decide that for me, but I need it to go on without me.
Yes,
Yep.
absolutely.
So we haven't gotten to talk to Louise, but I was really concerned. Um, when I saw John's MRI, it's a brain tumor, but oh, thank God it's this thing in the ventricle, because that means it would be less troubling. And then I had to go to the books. Another thing that is wonderful about my ability to be a good doctor these days is the medical library is online. So I go to the online medical library, look it up. Hey, this is probably something called an ependymoma, which is relatively benign. It can spread in other parts of that ventricle system, cause lots of trouble, sometimes need, in that case, chemotherapy, etc. But probably going to have a good outcome if we can get at it quick. Now, Louise, I was saying when we got interrupted that I was really worried she had a bile duct tumor, a cancer, and that's a bad actor. Um, you know, Miracles are happening in cancer care these days. But 5 years ago, she'd be a dead woman in 6 months if that was a cancer, a biliary tract cancer. Well, thank God it wasn't. Her sphincter of Oddi, right here where the bile tubes, the pancreas is over. This is the pancreatic duct. This is the common bile duct, and upstream is the gallbladder and the liver, and it drains the bile. But there's something here called the sphincter of Oddi. Oh, look, it even spelled it out for me. But it was having it was hypertrophied and spasm and blocking. It was too tight, and that's all it was, and it required a stent. And many people, adults have had a colonoscopy. Well, similar technology can go all the way there and put a dilator in there and let that thing drain. So that was great news. Unfortunately, we got the answer, quickly. While the rest of the family is worrying about John's brain tumor.
Yeah, I cannot believe that you're going through all of that together. You're talking about dad, husband, father, then grandma and mom, right? One of the things, Dr. Willey, you had mentioned to me in some of the notes is that you want someone to take care of you as if it's your husband, your father, your son that is an actual doctor. John, you know about that because you have a surgeon in the family? You had a surgeon in the family?
Yes, and my mother, Louise, is a nurse as well.
Oh, wow. So you know what it's like to have that in the family and to be able to say, "Oh, hey, let me call you up." But that's how Dr. Willey is. It's like having a doctor in your family. He acts that way to every one of his patients.
Absolutely true. 100% true.
That's right.
So Dr. Willey, again, with Innovare Health Advocates, and we're talking about just 2 of his many patients, and these are the kind of stories that would happen, that he would be that advocate for you immediately, and that is what I want you to remember. So InnovareHealth.com, again, is the website that I want you to go to. John, one of the things we've been going through over the last couple of weeks is I don't know if you've ever heard of these, but it's the 13 Virtues from Benjamin Franklin, which I had never heard of, and I felt like I was missing out. Now, I thought Dr. Willey just kind of used these on a regular basis. He did say he just kind of came across those as we were looking into the new year and breaking these down. So we have already talked about resolution. We talked about order. And then sincerity, which is one of the ones that I really, really love, because I think, we talk about being real and being authentic and being the best versions of ourselves. But let's break this one down, Dr. Willey. This is the slide that we really, really like. Do you want to talk about what it means for you?
Yeah. No hurtful deceit, think innocently, justify, and you speak accordingly. So I think that perhaps one of the most deceitful circumstances are a person with themselves, not being fully aware of what's going on for you and being honest about it and being afraid to talk about it. So, and that can interfere when people come to me. Some won't come. Thank God for wives and daughters. They make their dads and husbands come.
Yes. Right.
sometimes. But even when they get to me, there's a fear of telling me what's going on. So I think it's really important. And the sincerity, I like to bring humor into things. If uh, so, humor is important, but sincerity, being serious, focusing, getting the job done, understanding what's important in the moment, in the big picture. So, yeah.
We
That
all
is
do
my
need. I think just as human beings, we need to be more sincere with each other. Well, sometimes we need to be more sincere just with ourselves instead of trying to put masks on. That's what I see it as. And again, the authentic side of life. I really do believe that the world would be better if we had more authenticity and the sincerity in a doctor truly caring. I mean, that's what John and Louise and many other patients for 40 years have experienced with Dr. Willey is he truly sincerely wants you to get better. He wants you on a regular basis throughout the entire year to do the things he's asking you to do so that he doesn't have to see you as much, that you're healthy. But then there's circumstances that are beyond our control. We have to do everything that we can do on our own, but then there's things like this, like a brain tumor that happens to John and this obstruction that happens to Louise. Anything you want to say to Dr. Willey, John, that I'm sure you probably have said, but maybe want to say again?
Well, absolutely. Let me just say and tag on to the point about sincerity. And I'm glad you brought up the term about authenticity. Well, I felt the entire time what was probably the biggest relief for me was that what I was going through was a very complex issue. I'm not in the medical industry. I don't understand that. You hear brain tumor, and you get paralyzed. Well, I mean, he really just gave me matter of factly, and in terms I could understand exactly what was going on, exactly what he believed would happen, and exactly what my recovery might look like. And I'll just say it's panned out exactly as he said. But because he did that, when you hear the word brain tumor, you instantly start to shut down a bit and you think, oh my God, this is really terrible. And it is. But he gave me a very realistic and authentic understanding of what was happening. And that made me relax. And it made my wife and family, my mother, relax too. So I'm very, very grateful for that. God bless you, Dr. Willey. Thank you for everything you've done. It's changed.
I love it. I
Yeah.
love it. The authenticity
So,
again between both of you. I do have
piece
a
of
question.
value there, Monica, if I may.
Yeah, please.
As soon as there's another piece of wisdom from an old teacher. As soon as you order a test, as soon as you utter a word, you doctor, the people start to become sick, right? They start to worry and think, and what could this be? Talk to their family and neighbors, and depending on who they talk to, they're most of the time going to get their anxiety is going to get amped up. So we have to be very careful about what we're saying to the folks, to the patients, but then if we start an inquiry, okay, I'm going to do this test because of that symptom. Now, now that's really serious. It might be something terrible. So it's the onus is on me to get the answer quickly, if for nothing else, to erase the worry. So here's a family that's got, John lost a brother already to a disease. His father to a cancer at a relatively young age. He was a surgeon that I knew and liked and used, and
Sorry to hear that,
would
John.
have used him for longer if he hadn't gotten sick. So now John and Louise have. We know he's got a brain tumor. Louise might have a cancer, so the whole family's worrying. So
Sure.
it's another reason to get that Louise's ERCP done quickly, so we could erase that worry or be on with it.
Absolutely.
Right. And so in a couple of days, we erase Louise's worry that she's got a cancer. And anyway, that's really important. It's another reason to intervene early and get it done quickly and correctly.
Well, yeah, because we always talk about what happens when we worry, we have fear, we have stress, we bring on other I mean, sometimes truly bringing on sickness because of stress, because of fear. And if you can have someone advocating for you to calm the fears and again, get you in to take care of you earlier on, those fears hopefully start to diminish and
Yeah.
maybe completely go away. And that's what happened in this case. Dr. Willey, somebody just said before we have to wrap up, they're asking you what is autism? They want you to kind of describe what is autism, go a little bit more in depth into that.
Yeah, that's brain function, and we still don't understand fully what's going on there. But it's, you know, the brain is an electrochemical computer, lots of wires, microscopic wires, amazing structure. So in autism, it's those connections aren't working just right. Parts of the brain are working too well, some not well enough. It's a lack of coordination of that electricity. I'm being pretty vague, but we don't really understand it biochemically or structurally.
Okay.
Right.
Okay. Again, every Monday, if you ever have any questions for our doctor, please just shoot them into the comments. Or if you can, and you really want us to go in depth, get them to me in advance so I can get to Dr. Willey and we can kind of break that down for you before we get into the next Monday. By the way, as we mentioned, we're going through all the virtues. We'll have to have you pick another one, Dr. Willey. So we have that would be our fourth, because we've gone through 3 of them already, 13 virtues of Benjamin Franklin. And I really do need to read up more on him because he just sounds more brilliant than I ever thought that he was. Ask the Doctor with Dr. Charles Willey, brought to you by Innovare Health Advocates. Again, healthcare the way it ought to be, like having a physician in your family and advocating for you. InnovareHealth.com is the website I want you to go to on both sides of the river. Again, he's also affiliated with 11 hospitals. So when you need to get into a certain hospital, it's that connection that he has. John, tell your mother I enjoyed 2 hours with her last night, and I thought it was going to work for her, but I think she may have had a connection issue. But I'm just so happy that Dr. Willey was able to get her care. I know you are as well. That's your mother, right? We will do anything for our moms.
Absolutely. It was a weird time, but Dr. Willey took care of 2 very complex issues on the same day, and I'm very, very grateful for that.
Well, let's make sure that there's nothing else creeping around the corner for the Donovans for a while. Let's have a good 2024. Yeah. Thank you both so much. I greatly appreciate it. Dr. Willey, any last words before I take a break?
Yeah, just be honest, be candid, talk, speak up. Yeah, speak up. Give me a call.
All right. You want to, again, InnovareHealth.com is the easiest way for you to get their information, their locations, a phone number to set up and to say, I'd like to come in for a consultation. I think this is a doctor that I need in my family. And I would say the answer is yes. That is exactly what you need. Dr. Willey, John, great to see you. Louise, if you're listening somewhere, it was great to have you for a little while. And again, I'm so glad that Dr. Willey was able to help both of you. And this is what you want, again, for your own health. So be your own advocate and then have an advocate working for you. Dr. Willey, thank you so much, John. Thank you.
Thank you.
All right, everybody, I'll be right back. We've got a few things we would need to wrap up for you. We'll break down again the upcoming Cultivating a Vision and where you can join our broadcast live on Thursday. That's coming up after the break. Hi, it's Monica Adams. Thank you so much for following along with The Real Monica Adams Show since we launched back in March. But I wanted to let you know there's so much more that I could do with you, your business, your corporation. Did you know that I'm a motivational speaker all around the world, as well as an MC and an auctioneer? So if you have an event, maybe a nonprofit organization, and you want to book me, just shoot me an email, info@TheRealMonicaAdams.com. Personal training, life coaching, and styling as well. Info@TheRealMonicaAdams.com. Invita Invita Health and Wellness, where you can feel your best both inside and out. Invita isn't your typical med spa. They're a multi-specialty medical spa and wellness center serving St. Louis and its surrounding areas. They have ketamine for mental health and pain, IV therapy, medical weight loss, and aesthetics treatments. As board-certified anesthesia providers, Invita can ensure that their advanced treatments are provided safely with minimal to no pain. So let Invita take care of you. Call 314-394-0950 to book an appointment or online invitahealthandwellness.com. Well, welcome back again. It is the Real Monica Adams Show. Some funky different scenes that we have here. We can even see some of the comments from you on the screen. Love all the different changes and love all the new things that are coming, which I have been scrolling across the screen for you. A new segment that you're seeing that starts in February. So we're just weeks away from Positive Talk Time. Instead of in the blue chair, I'm going to be sitting on the pink couch at Yuppie Puppy Pet Spa in Cottleville, which, by the way, is where Yuppie Puppies Forever Rescue is. And we've got a lot of dogs that need beautiful new homes. Their forever home. I just love following their feed and their page on the Facebook because you get to see all these wonderful dogs being adopted by all you amazing human beings. And so, yes, there's still more. The rescues continue. I want you to check them out. Again, Yuppie Puppy Pet Spa and Yuppie Puppies Forever Rescue. So we're going to start that. We're going to have fun for all of you animal lovers. She's got some great tips for us. And we're just going to talk about real life and positivity. We need a little bit more of that. So Positive Talk Time beginning on February 1st and every other Thursday. And then we're talking about these mobile Monica shows that are going to kick off. Now, the first one is on January 18th. That's this Thursday, and I'm hoping the weather cooperates with us. Looks like we're not supposed to have the possibility of snow until the afternoon, maybe evening. So I'm hoping that still stays the course so that we can do our wonderful show in actually a little bit warmer weather. So I can't believe saying that 35 and 34 and 32 is something that we're looking forward to. But in minus weather or zero or even 1 or 2 or 3 above, that's going to be a welcome sight in the 30s by the time we come around Thursday. And a lot of people love to run and bike and walk in weather that's in the mid 30s or upper 30s, 40. As you bundle up, you start to take those off as you get running. I saw in Russia that people were doing a marathon in like minus 20 degree weather, minus 25, minus 30 degree weather. Those are hardcore people. That's not for me. That's not for the faint of heart, but that's not what it's going to be like on Thursday. So our runners, our bikers, our walkers, come on by. Even if you have to head off to work and you're looking for somewhere to grab a nice cup of coffee, maybe a hot tea, maybe some hot chocolate. I know that she has some quiches that are normally $4.99. She's going to discount them to $2 for all of you privy to the Real Monica Adams Show. So stop by, have a quiche, a coffee, say hi, even if it's for a few minutes as you're heading off to work. It's at the Bike Stop Cafe, which is in St. Charles, just off of Main Street. I would love to see you. We're going to have a really beautiful woman-to-woman talk as we gather together and we talk about a lot of different topics, including entrepreneurship, including a family-owned, woman-owned business. It's the woman-to-woman interview, and we say not just Jody, but Dr. Jody Devonshire, because she's actually a PhD. The woman is ridiculously intelligent and has a wonderful, kind heart. So again, Bike Stop Cafe, that's where we'll be on January 18th. I'd love to see you. If you can't be there, then mark these on the calendar. February 8th, I was just visiting on Saturday with both Tracy and Jules, who own not only Espresso Yourself, which is in the city in the Southampton area, as well as Sisters Sandwich Shop, which is directly next door. So we're going to do the live broadcast on February 8th from Espresso Yourself, and then we're going to return 2 weeks later and talk a little bit about Sisters Sandwich Shop. And we're going to have fun with you because they've got a lot of really cool memorabilia on the wall, and I'm going to have you guess the pictures, what TV show they're related to. Some of them are really easy. Some of them might get a little hard. You got to reach back into your younger days when you saw these. Really cool place and great food, by the way. The names of the sandwiches crack me up. One of them's like, has to do with Celine Dion, but it's Celine Dijon. There's What You Mean You Don't Eat No Meat. That, of course, from My Big Fat Greek Wedding. And that's what I got. And I got it on a wrap. I didn't want a lot of the bread. So you can customize it. They've got food at Espresso Yourself as well. So those are some of the upcoming shows. So once we get beyond the end of this month, all of our Thursdays are packed up with live broadcast on Thursdays. How'd you like that? Would you like us to come to your business? That is an opportunity for you. I'll put my email address up on the screen for you again here. If you'd like to be a part of the show, you think you've got a person that you would like for us to shine the spotlight on, a great business, somebody that's really motivating and inspiring to show you where they came from and where they're going. Here you go. If you'd like to be a part of that, not only a part of the maybe the topic or a person that you want us to interview, but maybe you want to be a sponsor like our wonderful sponsors, our growing list of sponsors. info@TheRealMonicaAdams.com. And again, thank you to all of those that came on in 2023. Of course, Innovare Health and Wellness, our title sponsor, in Innovare Health Advocates, you just heard from, but it's also the wonderful, I love her, and I hope she's enjoying her vacation. You know that. I think if I asked you, let me do this actually. This is a little workshop we'll do right now. If I asked you who is the State Farm agent that I regularly talk about how much I love, answer that question for me before I put it up on the screen. This is the aspect of us giving back and helping those that help this show. So that's really the thing I want you to do is pick up the phone and ask for a quote. Ask for those dividend-rich policies. Ask for someone who's going to advocate for you in the insurance agency. I mean, literally, we needed a new roof, and it's the amount of red tape you have to go through sometimes to ever make that happen. So Julie Fabian just said KKP. That's what she's known by. Everybody else, what's her name? Who is the State Farm agent that I go on and on and on about? And I need to bring Angie and her husband on, by the way. They sent me a text yesterday and said, Monica, we cannot thank you enough for introducing us to, fill in the blank, the State Farm agent extraordinaire, because she has saved them hundreds of dollars for the exact same coverage they had with another insurance agency. That made me smile, and I thought, I love it. So Angie, you're welcome. To you and to anybody else that's called. All right, here it is. Yep, Kathy Kilo Peterson. I told you, you know her. You are going to fall in love with her, though. Call her, 636-561, there you go, 6460. Scan the QR code if you want, or go right to that website, kkilo.com. And why would you not want to save money? So Angie could come on and give us a little testimonial about it. She just joined with Kathy's group. They're, by the way, out in the O'Fallon area. They're right by the Yuppie Puppy Pet Spa in O'Fallon, Missouri. So I'm thinking of an idea of maybe doing a split show when we do these every other Thursday, that we have Yuppie Puppy on and then we run across the street and have Kathy on. If we can make that work, that's kind of my idea. That's what we're looking into. So yes, Kathy Kilo Peterson. If you have an agent right now that you never hear from, if you have an agent that is charging you a ridiculous amount of money, that's why I want you to switch. And it's as simple as picking up the phone and just giving them a call and saying, can you look at my policy? That's exactly what Jim just did. Jim said, can you look at our policy? Because if we're being charged so much more for the exact same coverage, then we're switching. And that's what they're looking at right now. She's also said, though, if you have a great agent and if you have great coverage, then, hey, she's not going to tell you you have to switch. But she said that she feels very confident that their coverage and the way that she and her agents treat you is unlike what you've ever experienced. So thank you, Kathy. 636-561-6460. Well, all of you, thank you. Tomorrow morning, and again, it all depends on the weather, whether or not we go like this or he is in studio with us. Haven't made that determination yet. But here's the book. It's called Always Adventure. And the name of the author, Andy Way. He's not just an author. He is a motivational speaker. He is brilliant. And this book is absolutely incredible. Powerful practices for living a happier, more fulfilling life. 5 of those practices. So if you are not January 24th, myself and Kasia Sitars can help you as we go through unpacking 2023 and looking at 2024. So go to the website, TheRealMonicaAdams.com, and click on events, and it'll take you right there to the tickets. We want to change your life and give you the best life that you deserve. All right, everybody. Thank you so much again. Stay warm as well, Stephanie. Thank you. Oh, Marilyn says, of course I know her name. Thank you, Angie. I know, right? We're sending as many people as we possibly can to you. Stephanie, you got it. Julie, you got it. Gwen, yes. Oh, Gwen said she's outstanding. So I guess she's her agent as well. Kathy, Kathleen, Julie, good job. Good job. Good job. That means you pay attention to the show. Everybody, thank you so much for tuning in today. We've got great shows coming up. that, but I still would love to know, what would you like us to have on this show? I want you to feel that this show is a big part of your life and that you actually get an opportunity to say what comes on the show in the future. Many times it might be just you and I motivating, inspiring together. We might do workouts together. We might see you in person at some of these live broadcasts, whatever it may be. Let's just keep going and affecting lives on a grand scale. All right. You know what I'm going to say? Go out if you can, or stay in, make some phone calls and reach out to people you haven't talked to in a long time. Whatever you do on that phone call, do one thing: be kind to them. Stay safe, stay warm, everybody. God bless you. I love you.